Hi, and welcome to the Pet Healer Podcast. This is your host, Dr. Mitsie Vargas, and today we're going to talk about asthma and other respiratory problems that seem to be exacerbated by the summer conditions of heat, wind toxins, mold, dust, all those things that we see in the summer. So, summer is a wonderful time for everybody to go to the beach and relax, but some of our dogs are not having a great time. And they could be related to the ability to breathe, and the heat is a little bit more difficult. And cats and dogs both can suffer from asthma. So, I'm going to talk a little bit about asthma and what is the TCVM sort of analog pattern. And basically, allergic asthma would be a condition where the respiratory tract gets completely swollen and reactive to something in the environment, which is transmitted in the wind. Therefore, in TCVM, it will be considered wind toxin. And the toxin is whatever the wind carries. It could be dust, mold, fungi, um, other bacteria or viruses. And in really, viruses and bacteria will be more of an infective state. But I'm talking more of a summer heave, summer associated asthma. And what can we do about it? So, when it comes to TCVM in dogs and cats, we have to consider that asthma could also be a kidney gene deficiency. Jing, Jing, is the ability to repair your cells. Like if you were to get an analog scientific term from current times, would be more like the telomeres. The ability of the cell to replicate and continue to produce a healthy cell. And so, of course, it's related to the genetic material. And of course, then it is congenital or hereditary conditions. And so, when the dogs are overbred, some breeds that are very rare and have small genetic pools, you can have several problems, recessive genes and problems show up. And asthma could be one of those. In cats, we have asthma as well. And it's not that just the purebreds get asthma, but I seem to see a wider range of cats with asthma that are a little bit more of in the purebred Siamese type. But then, of course, we have regular domestic short hairs and long hairs that have the asthma. And those are episodes, they're not constantly having issues with the breathing. They could live a normal life, and all of a sudden they have an asthma attack, which is they are open mouth breathing, they can't move, they might go in a panic because it is a threat to survival. So the animal doesn't know what's going on, and it can have like a bad repercussions for the people around them because they can react in fear and bite or scratch people that try to, comfort them or try to find out what's going on. In the cats, particularly, any stressful condition could bring that on. And the stress in Chinese medicine is known as liver qi stagnation. So, liver qi stagnation is basically any condition that causes the liver energy, which is like the mitochondria, the battery of the liver, to stagnate, to get stuck in that meridian and not follow up and nourish the other meridians. And so, how can we unstuck that energy? Well, acupuncture is a great way, and herbals are a great way. But basically, avoiding stress if your pet has been diagnosed with asthma. And usually, the asthmatic condition shows up within the first 3 years of age. As most genetic conditions, you may miss it the first year of age, but within 3 years is considered the adulthood of the pet, the prime time of the pet. So if it shows up in the first 3 years of age, then it's probably a kidney gene deficiency, a congenital or a hereditary problem. However, allergies can be developed as well. So exposure to toxins in the environment, exposure to the essential oils is one of the main ones that are causing asthmatic attacks in cats, especially certain essential oils that are pine or woody scented. Those are even worse, but they can be causing asthma attacks in cats. When it comes to dogs, a lot of the times we confuse asthma with collapsing trachea. Collapsing trachea is a condition in which the trachea, which is the main airway, collapses. And how does it do it? When the dog is super excited or drinking quickly a lot of water, then it kind of like as a prevention mechanism, when you're drinking water, you want to close your airway, you don't want to flood it. So that can happen when they're drinking a lot excessively and it closes up and then they can't breathe. It doesn't open back up. And then when they are in doing a lot of exercise or in the heat of the summer and you're walking them or hiking and you're not aware that they're very exhausted, they could start breathing very fast and that will cause it also to collapse. Kind of like one of those pop-up tents, like when they're just so flexible and malleable. Instead of having rigid tracheal rings, they have very flexible cartilage type, very flexible cartilage and thin cartilage rings, and those are prone to sticking to each other. And that's the problem because you need air to survive. So of course, the dog's going to panic, the owner's going to panic. The dog tries to do a reverse sneeze, basically trying to push air from the lungs, whatever air is in the lung, outwards. And it makes a funky nose, like that. It's really weird. So that kind of noise is related to the classic trachea, and it could go on for minutes, and people get really scared. And of course, the dog can suffer a problem, can pass out really if it doesn't have enough oxygen. But there's spasms on that air canal. So we need oxygen in those cases, right? That would be the treatment for humans. If you have an asthma attack, what do they treat you with? So they treat you with oxygen and they treat you with bronchial dilators and steroids. And so in cats, until 15 years ago, the only thing that I thought I could do for a cat that had asthma was to put them on prednisone for life. That was it, because I couldn't predict when they will have an attack. So prednisone is not without side effects. Obviously affects the liver, shortens your lifespan, makes you gain weight. So it has, and retain water. It has a lot of side effects. Also with the pancreas, it could cause diabetes eventually. So therefore, is not the ideal way. If you can avoid being on prednisone for life, then that would be a ticket. But of course, if you have an episode, then steroids are more than indicated. It can save the cat's or dog's life. And so, of course, that was the treatment that I knew before. But now that I do Western medicine, I have another tool. One of the tools is acupuncture. So I can quickly do a point called Ding Chuan. Ding Chuan is a classic point. It's in between the scapulas, right where your neck meets the torso and you're moving. You can actually feel that by raising and elevating and going down with the head on the dog. And right where the hinge is, that's your C7, T1, cervical 7, thoracic 1, right? Junction. And so that area, you can grab it with your fingers and squeeze really hard or press down really hard if your dog is having an attack. And it is magical. Oftentimes I'm in the exam room and I'm trying to talk to the owner and the dog's having like a cough attack, and I just grab onto it and the cough stops immediately. And so it's kind of like a magic trick. But you can use it for your advantage if your pet is having that. So remember, at the hinge level where the neck meets the torso, right on the dorsal edge midline, just grab it right in between the scapulas before the scapulas start, right? So that's Ding Chuan. We can also use any of the points of the lung channel. Lung meridian is directly related to the Sang Fu organ, lungs, but also with the skin and also with the allergies, skin, immune system, and of course, what we're worried about is right now the airways. So we can use lung one, which is right at the junction of the top of the forelegs where it meets the pectorals. Right there, you can press. So move the leg, see where it ends, and on the inner part, the medial side, the inner part of the head of the humerus, you can just press in there. And that is lung one, and it really helps. It's local to the chest, and it really helps to stop the cough. Another thing that we do is use herbs. The best herb by far that I have in my arsenal is Breathe Easier. I love the name because you want to breathe easier, so just get Breathe Easier. So it's great for heaves, for any kind of dyspnea, which is an abnormal breathing, COPD, but collapsing trachea or asthma. Those are great reasons to use it. And what it does, it boosts up the chi of the lung and the kidney. As I mentioned before, kidney is involucrated in this situation because it's your genetic pool, and lung is the one that controls the airways and the lungs, so definitely they're involucrated. And it is a very safe formula, and it has a classical formula antecedent, and it is called G.J. San, and this is from 1608. So over 1,000 years, right? Very, very old formula, but it works. So Breathe Easier is based on that. They have a couple of modifications, but some of the herbs that they have are open the lung and eliminate the phlegm, anything strange phlegm. So that's Yi Yang or platycodon. That's the herb that we use. And Bai He or lily. Lily moistens the lungs and tonifies the lung yin. The yin controls the fluids, and the fluids in the lung, if the lungs are moistened, they will actually repel the wind toxin, the invaders, the pathogens. But if the lung is dry, then that's a problem. So there's other ones like Jinren. Jinren stops the cough and the asthma. And of course, they have some other herbs like Dangshen, which is tonifies the qi. Because if you're not breathing properly, that means you have a problem with the chi, right? The chi is that energy, that life force that allows you to perform all the functions that you need. So if you don't have that, then that means that you're lacking chi. And we can do the herbs supplementation and help with that problem. We can also change the food. In fact, I often say to people that adding chi boosters to the diet might be the best way to control the asthma because you have to eat every day. The herbs you could do every day as well. But of course, after a certain time, like after 3 months of using the same herbs, you should take a little rest just because the body gets used to it, It's no new. And it can change the pattern as well. So you don't want to overdo it. But the food you can do always, and it's very easy to do, and it's always a very, very big factor. So definitely based on the constitution and based on the difficulty, which is in the lung and the chi, you should use the food therapy energetics to try to fix that problem. But what happens right now? You have your pet, you're walking them. Let's say you have, like me, pugs, and I have a 13-and-a-half-year-old girl, Miss Daisy, and she doesn't like it out there right now. She likes AC. She doesn't like the heat. But one thing that I have at home, and I have it at my practice, is called Pawprine Oxygen. It is basically oxygen for pets. And so it's not cumbersome, like carrying around a giant oxygen tank or having to set up an account with an oxygen tank delivery because you cannot just have oxygen. But Pawprine Oxygen is for pet owners. And what it does, it has canned oxygen in little cans. And I'm demonstrating for my YouTube people. But they're little cans. They look like any aerosol cans, and they contain up to 20 minutes of pure oxygen. And what you need to do is you need to get a regulator, which we have here, somewhere in here. But also, how are you going to administer is in a, basically, is a PET mask. So it is a cone-shaped mask, and it attaches to the regulator. And then that regulator is attached to the bottle, the can, and then that's how you use it. And basically, you can refill the cans. Once you spend your money on the regulator and the mask, then those are fixed costs because then you can always use it. And then all you have to do is just get more oxygen cans. So oftentimes 10 liters of oxygen, and you can slow the rate down and you can get 20 minutes. And why 20 minutes? Because an asthma attack, if you're still having an asthma attack after 20 minutes, you're probably, be in very big, deep trouble. But it gives you enough time to reach an emergency clinic. It gives you enough time to rescue the situation. So I encourage people, especially in the summer, if you're gonna go hiking with your dog, and if your dog is elderly, if your dog has heart failure or heart disease, well, heart failure, she wouldn't go walking, but heart disease, which, elderly dogs do have problems with the valves. It's just a matter of aging. And so if your dog has heart disease or it has any problems with the respiratory tract, like asthma or COPD, then I would strongly recommend that you carry in your backpack this oxygen because it can save your pet's life, and it actually can give you enough time for you to reach an emergency situation. The herbs and the oxygen, obviously, they all go together. Is not one thing fixes everything. But for example, for the herbs, I would definitely recommend to do it in the summer months, starting late May and finish it for the 3 months that are the hottest, at least in Florida. June, July, August are just extreme heat. We recommend not to walk the dogs in the height of the day, just dawn, dusk, and the middle of the day, you have to get them out to do their business in and out. So, but walks, they need the walks, they need the enrichment. So I'm definitely advocating for continuing that, but we have to be very careful because of that. So the TCVM pattern would be a wind toxin, right? That will, and then a kininogen deficiency. We mentioned that. But oftentimes we have a problem with, like I said, stress. So when those guys that have stress are getting the asthma attack, then in that case, we need to also think about the heart, because the heart contains your shen, your spirit. So how can we calm the pets? By the way, when you're doing oxygen, you can actually get like a little drop. You can actually rub your hands or rub the drops of lavender, just a little bit, not a lot, just a little bit of lavender in there just to calm. If the pet is very anxious, you can do that. Or Feliway or DAP, which are pheromones that are calm them down. They're pheromones that they emit normally. So when they smell it, they feel like they're with mothers or dad in the den. So it gives that feeling of being safe and secure. But in the case of the dogs that are having an asthma attack, because they're stressed, you took them to a place, they saw their dogs or dog park, and they saw their dogs, and all of a sudden they start having a panic attack, which is like an asthma attack. Obviously, having the oxygen would be wonderful because it's very portable, but using your anshen, which is right below the ears, in that fossa, in that deep crevice behind the ear, where when you pet your pet, sometimes there and you're rubbing behind the ears, they just go like and they just feel so good. It's because you're rubbing the point called anshen, or calm the spirit point. And so that's a very good point that you can use to calm those dogs that are having a panic attack, an asthma attack, just because of the stress. And always be cognizant. If stress is something that really gets your dog going into the asthma attack, then trying to avoid stress would be your primary objective. So, for example, those dogs probably should not be boarded, probably should be arranged for a sitter to come and stay with them, because that could really cause a destabilization of their system, stagnation of the chi and the energy of the liver, and then cause all sorts of problems. And so I would be, my recommendation, I would be honest with you guys. We do have a giant boarding facility, but I don't like to board elderly or animals that are compromised in the regular boarding. I would rather do a medical boarding because we have oxygen available and everything. But I often think it might be best for them to not change everything in the environment, to just keep them on home and just have somebody that they know come over, that they met in advance, I guess, come over. And then, of course, give guidelines and give the herbs and anything, any supplements to calm them from the stress. There's definitely one called Shen Calmer that I recommend. It's an herbal that basically very, very safe, just like Breathe Easier, but it does affect the Shen, the spirit. It calms them down. It tonifies the heart. It's a heart, blood, and yin tonic. The yin in the heart, again, if it dries up, your thought processes are not that great. And it has many repercussions. But heart and lungs, again, they're together in the chest. So definitely there's a correlation between them. So stress will kill you, kill your pets too. So avoid stress at all costs. So I hope that you are excited about Pawprine Oxygen and that it was something new that you didn't hear about, and that you're excited about Breathe Easier and Shen Calmer, which are options out there. And if you learn a couple of acupuncture points to help you in an emergency, that will be wonderful. So until our next episode, please subscribe, share it, help me share my passion and raise awareness about TCVM. And until then, take care.